Good evening, Berkeley, and thank you for joining me for my twice-a-week update on the City of Berkeley's response to the COVID-19 pandemic. And I want to start out like I have with every one of my updates to thank all the essential workers, our city staff, including our first responders that are working to keep our community safe, as well as provide essential services during this time, the frontline medical staff working in our hospitals and clinics, working to provide care for the sick and comfort for the families that have been affected by this deadly virus, and the Berkeley community. Thank you for staying home to save lives. Thank you for practicing physical distancing when you are outside. Thank you for following the guidance to wear a face covering. And thank you for what you've done to support your neighbors and support your community, whether it's donating personal protective equipment or face coverings, whether it's providing meals for frontline medical staff, or whether it's donating to the Berkeley Relief Fund. I just want to let everyone know that we are close to raising $1 million through our Berkeley Relief Fund. And so please donate today if you have not already at berkeleyrelieffund.org, berkeleyrelieffund.org. And we will be moving ahead with the second round of funding for business grants to support our small businesses. So stay tuned for information about how to apply and on those grant awards to our local businesses. I want to provide an update on the number of cases as of this morning. There are 66 COVID-19 cases, and we learned about a month ago that one Berkeley resident has died due to complications related to COVID-19. There are no other deaths at this time. 1,540 tests have been conducted at Berkeley residents with a positive rate of 4.29%. And we are conducting on average around 39 tests a day, but we're aiming to expand this capacity to 240 tests a day. A pilot program was conducted this week where all the residents and employees at a skilled nursing facility were tested, and the results came back negative, and we plan to expand testing at other skilled nursing facilities in Berkeley. If anyone who lives or works in Berkeley is symptomatic, they can get tested by calling our COVID-19 test screening line at 510-981-5380. Once again, 510-981-5380. The line is open Mondays through Fridays, 9 to 4, and is available in English and Spanish. And so if you're not able to get tested through your healthcare provider and would like to get tested, and you are symptomatic, you have one of the various symptoms of COVID-19, please contact our test screening line and we can get you tested. The city is working on building up a team of contact tracers to do more contact tracing and case investigation. This is a critical indicator to us understanding the level of spread of COVID-19 in our community and to make decisions about how to reopen our economy. So stay tuned for information about how you can volunteer to be a contact tracer. The Bay Area and Berkeley continue to enforce the current shelter-in-place order, even though the state has announced that they are relaxing certain restrictions on businesses. We are not at a point where we are ready to move to the next phase, but please know that efforts are underway to reach that point. And so under the state guidelines, which were released last week, local jurisdictions need to reach a certain number of tests and contact tracing, in addition to other requirements such as looking at hospitalization rates and capacity, social distancing protocols, and access to protective equipment. So efforts are underway to develop a Berkeley-specific plan to move us forward to the next phase after the shelter-in-place order. This plan will be guided by the latest science and data. We don't want to move too quickly and risk more infections in our community, but we also know that we have to also move more quickly in order to reopen our economy and get people back to work, get our businesses open. So we will be working with our public health officer and with city staff in consultation with business sector leaders and other stakeholders to get input to develop a Berkeley-specific plan. So please stay tuned for information about that. The governor announced this past week that vote-by-mail ballots will be mailed to all registered voters for the November 3rd general election. I know there were a lot of questions around how will COVID-19 impact the election. It will not stop us from proceeding with an election, And the state has now made it clear that they will be sending vote-by-mail ballots to every registered voter. People who do need access to in-person voting opportunities, including persons with disabilities and people who who speak multiple languages, will still be able to access in-person voting, and postage will not be required for you to mail your vote-by-mail ballot. So this is going to be critical to making sure that everyone can participate in this critical election. And so please stay tuned for more information about the election. We've gotten a lot of questions about the mask requirements, and I just want to clarify that masks are required when you are inside or in a line of an essential business. If you are working at an essential business, you are seeking health care, or using public transit or taxis or rideshare. Masks are highly recommended to be worn when you are outside, but not required when you are outside walking or in a park. Everyone should carry a mask with them at all times. If you do not have a face covering, please find a police officer who is actually carrying face coverings with them for free, and they will provide you with one. Please carry a mask with you. Please wear a mask when you are inside or you are in contact with other people. And if you do not have a mask, please find a Berkeley police officer and they will provide you one. Lastly, I have provided an update in the past on the city's budget. Tomorrow night, will be discussing the city manager's proposed fiscal year 2021 budget. The city is projecting a $28.5 million deficit. And this is based on projections of revenue losses at the present time, knowing that that number could increase due to the prolonged nature of COVID-19, the fact that the university may not have in-person instruction. And so we are already employing certain budget balancing strategies like a hiring freeze and looking at deferrals of projects and positions. And we will be continuing our budget discussion over the next 2 months, not only in May, but also in June. So please stay tuned for opportunities to participate and make your voice heard about how to balance our city's budget to preserve health and safety and essential services. So please join me on Wednesday for another update on the City of Berkeley's response to COVID-19. And in closing, thank you, Berkeley. Please stay home to save lives. Please remember to wear a face covering when you are outside. And please practice physical distancing of at least 6 feet between people that are not in your household. This is essential to reducing the spread of this virus, and it is working to flatten the curve. So please be safe and have a good evening.